Meet Phil and Jerry. They've been best friends since elementary school. Now in their 50s, they share more than just family vacations together. Both men have had unrelated gastrointestinal issues investigated by their doctors in the last couple of years. During a routine colonoscopy 2 years ago, Phil's gastroenterologist found a very small polyp, which was removed and turned out to be benign. 1 year later, Jerry was found to have a condition known as Barrett's esophagus during a routine endoscopy. The gastroenterologist who performed the procedure did the appropriate biopsies, and there was no evidence of any dysplasia, a type of cell with an increased risk of developing cancer in someone with Barrett's esophagus. Now each man's doctor has ordered follow-up tests for each of their respective conditions. A colonoscopy for Phil and an endoscopy for Jerry. Neither is looking forward to their test. National GI societies have found that in cases like Jerry's, it is safe to follow up on his Barrett's esophagus in 3 to 5 years. Some gastroenterologists may suggest another endoscopy sooner than is actually recommended or needed. A practice that has its own risks and high costs. Fortunately for Jerry, his health insurance company has partnered with eviCore Healthcare, so any request for gastroenterological tests must undergo a prior authorization process. To make sure that the procedure follows these National GI Society guidelines, one of eviCore's board-certified gastroenterologists reviews Jerry's case and notices the lack of dysplasia. After fully reviewing his chart for any other extenuating circumstances, the endoscopy is denied and a recommendation for follow-up at a later date is given, saving Jerry from the risks and costs associated with an unnecessary procedure. Phil isn't so lucky. Since his insurance company doesn't partner with eviCore, there is no prior authorization process, despite the fact that the American College of Gastroenterology guidelines recommend that his particular type of polyp can be safely followed up on in 7 years. Phil's doctor, unaware of this recommendation, moves forward with a colonoscopy. Later that week, as Phil and Jerry get together over drinks, Phil, slightly jealous, listens as Jerry tells him he gets to skip his endoscopy on eviCore's recommendation. Jerry, meanwhile, laughs as Phil describes the cleanse he has to undergo for his colonoscopy 2 days from now. eviCore Healthcare partners with providers and health plans to enable better patient outcomes and enhance safety. For patients like Phil and Jerry, this means they receive the most clinically appropriate treatments and tests at the right time. For providers, it means having access to valuable resources backed by up-to-date clinical evidence. For healthcare payers, it means that their health dollars are being spent on the most effective treatments and procedures for their members. eviCore's Gastroenterology Solution is the right choice for your patients. Find out more today.